Hi everybody, I'm the dental assistant tutor and I have come across so much knowledge in 30 years of my career, and I still teach dental assisting, but I am semi-retired from the actual work office. I am dedicating my time right now to helping dental assistant students around the world, dental assistants, dental professionals make more money and feel better on a day-to-day. There are all kinds of stress issues in the dental field, and so on my dental index page I have a moment where you can sit down and just enjoy the jokes that are on there. I also have educational videos for the up and coming rising dental assistants that are taking the places of us seasoned assistants. And I want to leave behind all the knowledge that I've gained from the inner city to the country living and even working in an all Amish community. So please check out my link below and enjoy the videos that I've uploaded on my channel, and don't forget to like and subscribe. It's nice to give back to those who are trying to serve others. Don't forget that, because I feel like we're losing that in the dental world and just in the general public, to just give thanks and say, I appreciate you for giving me this knowledge. And when your boss is teaching you something, or you find yourself with a coworker, take it as constructive criticism. We are losing that. We're just thinking people are getting upset with us. But truly take it to heart and say, what can I learn from this, and how can I become a better dental professional, a better dental assistant, and even, yes, a better boss, a better dentist. There are so many things going on in the dental community on the social medias that is bringing to light how dentists are treating staff members, to where I've heard on social media they need to wear more makeup. And that's in, he told his staff he needs to wear more makeup. They need to wear more makeup. And there's just a number of things. Girls getting fired because of their social media. So if you're looking for a job, remember to clean it up, and just because it's on a screen doesn't mean that there's not going to be people that that find it, if you have a fake name or anything like that. So remember, clean up your social media. Dentists, don't fire them because of their social media. Just have a good old-fashioned conversation as a boss and say, you have to clean this up because you are representing us. And that includes when a student comes in and they might have a tattoo. I had an A+ honor roll student look for work and could not find work until she emailed them after I told her, asked them what's going on. And to find out she had a tattoo that was causing her not to get hired. So she could wear her hair down, she could change her hair. The office did not want to hire her because of the image. Well, we have to roll with the way that things are changing in this world, and people are being exposed to everything on social media. So hiring someone who has a tattoo is not a bad thing, or piercings. Just ask them to clean it up, take it out, cover it up. Don't lose the chance to hire somebody that is very capable of doing the job and would be probably a dedicated assistant to you. I know there's a lot of dental instructors out there that give all their knowledge to their students. And I know you dentists can come across some that find the students that were robbed, paying so much money for schooling that they have to pay back, but their instructor did not give them all the wisdom they need. Don't fire them. You came across this video for a reason. Use the other page, the Dental Index Junior, to help train them again. Teach a man to fish, he'll eat for a lifetime. Same goes with suctioning. Teach your assistant how to suction if she's not doing it properly after attending a program. Unfortunately, that does happen. But you hire them and just give them that opportunity to learn from you. Do not yell, do not swear at dental assistants or anybody else in the office. If you're a husband and wife team, I've come across that there's a lot of issues with that. One will want the assistant to do this, the other one will want them to do that, and then the person who's hiring is stuck in the middle. Please don't put your staff members in the middle of your guys' issues that could be actually more deep-seated than the general office itself. You have to find happiness. Life is short. I want all dental professionals to enjoy their day, wake up, and how many teeth am I going to fix today? And just give your coworkers and your boss a pat on the back. And bosses, I've also heard a lot about salaries. And it's really sad because we work just as hard as LPNs and RNs. And some dentists don't start them off fairly, and some start them off very well. If you're one of the ones that start off very well, thank you. But if it's one that, things are tight at your practice, dedicate jobs to your staff. I have how you can make websites, how you can make money through your practice with being affiliates. So there are ways that you can increase the revenue at your office and increase the salaries that these dental assistants so desperately need. I once worked for a dentist that I love working for. It was just a great platonic, awesome relationship. We both had we were both nerds in dentistry, let's just call it that way. And so we both enjoyed doing that cosmetic dentistry. But after 3 times of asking for a raise and never could do it, even when I was the one that gave him a raise by increasing his salary fees, asking him we should do that because he was a new dentist. So when you start to see that income come in, please be reserved and save some for your staff. Share. They need it. Some of these dental assistants are struggling out in this world today, and they shouldn't be, because in another state, they're doing just great. Their family's proud of them. They're not asking, can I borrow this or borrow that? I can't pay for my CEs. Most dentists do provide that, but if you're not, it's a tax write-off for you. It's a tax thing. So help them out. If you are having issues with your dental assistant, if there's too much gossip going on behind the closed doors or in the operatories, and we all know those treatment rooms are paper thin, have a sit down with them and talk to them, and I think my worst experience was the office that I asked for a raise that I cared so much about and spent many long hours making sure everything was perfect every day, that half the team that was there longer than me was not on board with me. Okay, they did not care about reaching production, and the dentist was blind to it. Okay, and you befriend them even though it's hard because you want to do what's right for your boss, but this other staff kind of gets cliquey, and you don't want to become cliquish. If you fall back to the dental assistant creed and the dental assistant pledge for those dental assistant students out there, it says to be loyal to your call fast and to your employer. That means you're calling to you and to your employer, the person who signs your check. And there shouldn't be any gossip. It's okay to make friends in an office, but there should not be no gossip. There should be no, well, we didn't get bonus last month, so I'm not going to even try to do it this month, and tell the other staff members, because you're hurting those other staff members by depending on taking care of their kids with that bonus check. So for all those ones that are shady out there, please stop. You will be caught. In my 30 years, every person who's ever done anything wrong in a dentist's office has always gotten caught. I've seen dental assistants who've had the keys to an office go and have an affair on their husband, not with the dentist, but I've seen that too, and leave period blood on the carpet. And because I cleaned the office, I came across it, and then the person ended up being lying on their time card. You have to be careful who you hire. And if you get that privilege and that blessing to be hired, you want to be able to stay there. So we need more communications going on in the dental field, and we need more raises going on in the dental field, and we need more staff members to step up, quit complaining, and just get to work. And then things will be so much better. We have to regroup. And this was not everything I wanted to say in the message. I didn't plan on saying this much, but it needed to be shared because I do care about people I do not even know. Because I have served for 30 years and I have been done wrong, and I want to take that wrong and make it into something good. And even for the students that I teach and students I do not teach, I want to give you the wisdom that I know. And I know the courses can be 10 days, 10 Saturdays, 6 months, 2 years, from $1,000 to 17. I've seen $20,000 for a school education to become a dental assistant that you may or may not make it in the field, to be honest, and you may or may not make it with that hourly wage that you're hoping for. My hope for you is that you do not give up, that you stay strong, you do not take a no for an answer like my one student who realized what was going wrong with the interviews. You will get hired, you will learn more and educate yourself throughout your whole career, and that, just so you know, that keeps Alzheimer's away. And it's great that the dental career is always changing, always learning something new. So alright guys, don't forget to like and subscribe this video. I hope it helped you. I will be doing more videos to just tell it like it is in the dental field, because I no longer have anything to lose. I'm a teacher and I'm putting out great assistants out there. I sleep good at night, and I don't have to work for a dentist to where I have to worry about getting fired because I'm asking for a raise, where some of you guys have to. And that's where I'm going to come in and just start speaking up. And it's not just about the money, you know. What about I'm going on, I have to. What about free dental for the staff members? Or when you do dentistry, you put your heart into it. Now, I'm going back to the one that I love working for. You know, he did my fillings in my anterior teeth, number 8 and 9, instead of doing crowns and let me pay for the lab costs, you know. It's like, let's try this again. Let's try this again. And I left there when he fired those girls because I was not warned about it, even though he had to be known about it. So I shared it with him, that because I was not getting my bonus, so you have to be honest, you know, because he's stressing out and you know they're not pulling their weight. And then there comes a moment you have to decide your career or friends. And with that, I have enough friends. So it came down to where I would hope that they would forgive me one day for being truthful with my employer. It was the hardest thing I had to do, but to know that I was not getting great bonuses because they were not doing their part. They were not adding codes on where they should have added codes. They were talking to patients behind his back about, you know, him and sales rep and how cheap he is. And doctors, if you don't think people talk about their Christmas bonuses, you're sadly mistaken, especially with the sales rep. They know about this dentist and that dentist, and they do gossip and they do share. Not all, but there are those ones that do. So keep that in mind. You know, the rule of thumb is treat how you want to be treated. And we're losing that in today's society. And it's sad. And I think if we just regroup, have a staff meeting, put ideas in, you know, get referral cards from your patients and find out, you know, what can you do better for your patient. You know, some patients don't like it when doctors and assistants talk over them, and you may not care, but that's your patient. What happened to the customer is always right. The patient needs advice. You know, give them multiple options, not just the most expensive one. You'll be amazed at what they will buy and what they will do for themselves. And there's all kinds of in-house treatment plans that you can do, and just work with them. Let's talk about the cleanliness of offices after 30 years. Since this video has gone nowhere I wanted to go. But 30 years in a dentist's office, I've went on working interviews, and I've seen disposable impression trays used again and again, being cold sterilized, but that's besides the point. The manufacturer says disposable, okay? This is still coming from the same office, not the one I've worked for. I did not take the job. I actually had to leave to go back to that office because the grass wasn't always greener. And so you might find yourself in a worse situation if you're thinking about switching jobs. So always do a working interview, and working interviews should be paid for by every state. I've seen it, I've read it, but it is not being applied, and it's not fair because they work hard for you. Now, mind you, some dentists, very few, maybe a handful, pay for a working interview. But that's where you guys are testing the waters, okay? It's just only fair, okay? It's only fair. Can we bring the fairness back to dentistry is what I'm trying to plead for the dental assistants, the dental hygienists. You know, do you know dental hygienists can actually go to school to become an EFDA? They can do that. And let's talk about EFDA school. And I'll get back to the cleanliness. But EFDA school, some states, you do not have to attend EFDA school. Your dentist can teach you how to do the fillings. And then the assistant can do that and then take the course. Or no, take the test. Skip the course. If you teach them hands-on and then they can order a book offline for EFDA, expanded function, which I did, it came from Case Western University, okay, and you self-study, you can pass the boards, and there you go. And then with that being said, it frees up the doctor's hands. You have more time to talk to the doctor. You have more reasons, you know, to go do other things for your staff, you know, while they're doing production for you. And the more you can do, the more you can make. I'm not saying pack your schedule full to where you're burnt out by the 4th day, because most offices are 4 days. But I'm just saying, there's other ways to make this a better environment for all dental professionals, because there are many that are getting burnout, and that saddens me because it is a great career. It's helped me as a single mom and as a wife, and I've worked with some great dentists and not so great dentists, and some that were great with attitudes and tempers and throwing things. We don't need that abuse. And let's go back to cleanliness. I've seen your plants. If you have plants, water them. I've walked into an office and all the plants were dying. And my thought was, if they are dying, how do they take care of their patients? How's the instruments? How's their, better yet, let's talk about how, and it goes with that, but let's talk about your office managers. Let's talk about, are they calling all the past insurance claims? Not all do. Hate to say it, hate to throw you under the bus, but something's got to be said, because, you know, dental professionals are struggling. Believe it or not, there are some that are struggling and there are some that are not. But for the offices that are struggling and about to lose and have to lock up their doors, you know, can you do a treatment plan? Are you following up on your treatment plans? These are all important things that you need to know. And my favorite dentist I've ever worked for, well, there's a few, but my most recent one, you know, he was honest. He says they're not taught business in their dental program as a dentist. And that's sad, because they need to know so they are not robbed. They know the things that they can do for themselves and start off great. Because when it all comes down to, here's the ending, okay? When it all comes down to a happy employer, number one, they give their aura to the happy staff. If the staff is happy, then the patients will be happy. And that's very important nowadays. Patients' care is really going down. It's a get them in, get them out kind of thing. And you can do a lot more if you just listen to your patient and help those that really need help and cannot afford it, because word of mouth will go around and you will be blessed for even doing some free care for some people, okay? So give back to the ones that are less than fortunate, and you'll see your blessings bestow upon you. And this is for all the dentists out there. We need a change. So please, if you're one of those that's just stressed out and angry, find a hobby. I started doing artwork. We all have to have a hobby besides dental, all right? Too many teeth. They all start to look alike. Bye, guys. Check my links below. I hope this helps. Up and coming assistants, DDSs, office managers, Just, if you need help, email me. My email's down below. If you have a problem with somebody, email me and I'll help you through it. Come on, guys. Let's make a change. Let's make everybody smile.